February is National Heart Health Month, and today is National Wear Red Day. It's a day to raise awareness for the leading cause of death for women in the United States.
Yeah, here to talk more about heart disease is our 9 News medical expert, Dr. Payal Kohli. Dr. Kohli, good morning.
Good morning, guys. Happy Heart Health Day.
Happy Heart Health Day to you as well. Now, we have heard that women can experience heart disease differently than men, and risk factors are also different for women. Can you explain a little bit more about this?
Yeah, this is crazy. 56% of women don't even know that heart disease is the #1 killer. And in fact, just as many women as men die every single year of heart disease. So it's really important for us to talk about what it feels like. And in women, our nerves are a little bit different. So when men classically have that symptom of kind of chest pain or an elephant sitting on their chest, what we see in the movies, you clutch your chest, you're having a heart attack, you know it. Women's symptoms can be a lot more subtle. So we can feel just a little bit of really bad nausea, fatigue, back pain, uneasiness, chest heaviness or discomfort, but not that classic sort of elephant on the chest. And for this reason, women often don't know they're having a heart attack.
Right.
Their providers even often don't know they're having a heart attack, so they get diagnosed much later, which means they have a much worse prognosis.
I mean, those are symptoms that you can just easily brush off. Like,
Right.
just, I'm tired,
right.
things are going on with the kids, I lifted the baby wrong, whatever.
Well, and it's funny, our Broncos insider, Mike Kliss, he had a similar sort of trajectory where he started having really bad heartburn. And I'm not just talking bread and butter heartburn, like, oh, I just ate a little too much and I'd take some Tums and it's better. I'm talking heartburn that doesn't go away and creates kind of an uneasiness inside. He was having it for full 24 hours before he started feeling that elephant on his chest, and then he was in the throes of his heart attack. So even men can have these types of atypical symptoms, but more common in women.
So are there differences in how heart disease occurs between men and women as well?
There are. So if you think about a woman, we have all the risk factors that men have. We have more whammies from the risk factors. So for example, triglycerides confer a higher risk to women if they're elevated than they do to men. But then we have this this life cycle with hormones, right? Where we have our period, we have pregnancy, and then we have postmenopause. And during each of those phases, our heart is under stress. So pregnancy is the first stress test that a woman will ever have. And menopause is a huge cardiac risk factor, because the minute you hit menopause, your hormones change, your blood vessels change. So the types of heart disease we have can also be different. In fact, women tend to sort of block up what I like to say are the side roads of the heart, when men block up the highways. So sometimes we'll get tests that look normal, but we've got teeny tiny little blockages that are not showing up on the test, and we certainly are having symptoms from them.
This is why I think today is so important. We wear red, we talk about this. What are some of the things that we can do to cut down, our, likelihood of getting this?
80% of heart attacks and strokes are preventable with lifestyle changes. So we as women need to take control of our lives, and the men in our lives need to take control of their lives, and the women in their lives too. Because if we make these 8 changes in our lives, and it's called Life's Essential 8 from the American Heart Association, you could really change the trajectory of heart disease. And in the next 50 years, what I'm hopeful as a cardiologist is that we eradicate heart disease altogether.
What changes are those?
Yep, so there's some behavioral changes, and then there's some sort of characteristic changes. So you can probably guess what I'm going to say for behavioral changes. Eat, sleep, move. Those are your sort of 3 changes. You have good diet, you need to get enough sleep, 7 to 9 hours, and you need to move 150 minutes a week.
Are you writing this down?
Yes, I am.
Sleep.
That's a big one for us,
you
right?
guys,
Yeah.
That's huge. Yep. And then the kind of the other factors that we have, which is our blood pressure, our cholesterol, our blood sugar, and our weight. You work on those 8 things, and you will really, really stack the deck in your favor. Even if you have heart disease history in your family, even if you have risk factors, you can really change the trajectory of those.
It's all common sense things,
Yep.
but we have to try to implement them to change this. Dr. Kohli, thank you. And don't forget, you can find all of Dr. Kohli's topics, all of the segments that she's done so many of them, on our website at 9news.com. Thanks.